and welcome to all of our participants this morning. I'm so pleased that Security Health is doing these series to educate our members. My task today, as Ashley pointed out, is to give you some pointers to keep you on track for optimal heart health. And we will specifically look at the role of medications. All right. Hopefully my slides are moving. Yes, thank you. Just want to state that I don't have any relationships with pharmaceutical companies. Obviously, giving a talk on medications, that's important for you to know. And additionally, I do serve as a member on the board of directors of Sanford Health / Security Health Plan. Those are my two disclosures. And of course, as with any medical presentation, the information is being provided for informational purposes only. Please don't make any changes to your medical regimen without consulting your physician. Before we get into medications, I think it's important to recognize what can we do to keep ourselves on track for a healthy heart into the future. The American Heart Association is an excellent resource for evidence-based therapies and suggestions to this goal. And if you go to the AHA website, the link is on the slides, and perhaps Ashley, you can copy it onto the chat so that people can have it. But this website offers very informative, easy to understand suggestions for maintaining healthy heart. The catchphrase these days is called Life's Essential 8, and it basically covers 4 healthy behaviors and the management of 4 conditions to lead to a healthy heart. These healthy behaviors, as one might expect, is about eating well, being more active, and quitting tobacco, as well as getting healthy sleep. Eating well, I think most of us have heard lots about it, but please visit that page. I do want to pay a little bit of attention to the other 3, which is staying active. The recommendation is for at least 30 minutes of moderate intensity activity, which is as simple as brisk walking for at least 5 days a week. So a total of 150 minutes per week of moderate intensity activity. And that's what I would recommend to most of our most individuals, and certainly as we get older and the limitations of musculoskeletal system, I think brisk walking is probably the best thing you can do for your heart. Quitting tobacco, I cannot tell you how important this is. If there is one thing that you can do for yourself that will have the most impact, it is to quit tobacco if you do use it. Tobacco in any form is injurious to your health. And this may seem obvious, but unfortunately, it's a very addicting substance. And so I just want to reiterate that it's the most important thing you can do for your health. And optimal sleep, besides sort of timing of sleep, recognizing if you have obstructive sleep apnea, so if you snore loudly, if you're very sleepy during the day, definitely want to get checked out with your physician and get screened for obstructive sleep apnea. The other conditions that need to be managed well include weight, cholesterol, blood sugar, and blood pressure. These are the things that drive heart disease, whether it's coronary artery disease leading to heart attacks or congestive heart failure. So please visit the website and get the information, and it's in a very easy to understand format. Now, moving on to a few other resources. Obviously, in the short time that we have today, it's hard to cover everything in a comprehensive fashion, but these resources can give you a little bit more in-depth and comprehensive review of what we're going to talk about today. We'll start with the first most basic medication, and perhaps one of the most essential medications in all of heart disease, which is aspirin. Maybe a decade ago, there was a push to try to get everybody between the ages of 40 and 70 on aspirin. It was one of the key elements of a campaign called the Million Lives Campaign. We do know, however, now that the benefit of aspirin, while it may be there in a few individuals for primary prevention, there is an increased risk of bleeding. So it is definitely not a treatment that you want to use to prevent heart attacks in all individuals. The decision to go on aspirin for primary prevention should really be a discussion between you and your primary care provider, who can advise you on the risks and benefits. Having said that, if you have known heart disease, please do not stop your aspirin without talking to your cardiologist. The aspirin is a cornerstone of what is called secondary prevention, that is, the prevention of future heart attacks in patients who have had a heart attack or who have stents or bypass surgery. Another thing to consider is the use of aspirin in people with abnormal calcium scores. There is a calcium score CT scan that can be performed to assess the amount of calcium present in the arteries of your heart. If it is 0, wonderful. But if it is not 0, then some therapies may be indicated. We'll talk about the statins in the upcoming slides. But if the Agatston score is greater than 100, then aspirin may be indicated, except in people with very high risk of bleeding. So if you've had a calcium score and your calcium score is greater than 100, talk to your doctor about possibly starting an aspirin regimen if you're not on one. The other key point that I want to talk about is that if you're on aspirin for primary prevention, that is, you haven't had any real reason to be on it, and you've crossed the age of 70, please talk to your doctor about whether you should continue it or not, because in most instances, you probably should be stopping it. This diagram is very useful to understand the role of both statins as well as aspirin and other antiplatelet agents. This diagram is the lining of the heart, the heart vessel wall, and you can see that these yellow deposits basically are cholesterol deposits in the lining. As these deposits get larger, it can narrow the actual lumen or the inside of the vessel wall and cut off blood supply. But they can also get disrupted, and that would cause the platelets, which are small cell fragments, to come and join with each other and form a clot that can lead to a heart attack. So aspirin prevents these platelets from clumping together, as do other antiplatelets that we're going to talk about. And moving on to the other antiplatelets, clopidogrel, prasugrel, and ticagrelor. These are powerful aspirin-like medications that are used in the treatment of heart disease after a heart attack or after a stent is placed. If a heart attack occurs, typically you will be on one of these 3 medications for at least a year after the heart attack, if there are no bleeding complications. For folks who have a stent without actually having a heart attack, like you had an abnormal stress test, we may use these medications, particularly clopidogrel or ticagrelor, for about 6 months after a stent is placed. Your cardiologist will determine if it should be for longer or not. Please do not stop these medications without talking to your cardiologist. And obviously, bleeding is a major side effect, but I'll take a moment to point out that ticagrelor can cause some breathlessness in a small but significant portion of patients. So if you experience unexplained breathlessness, obviously you should be talking to your doctor, because it could be a sign of some recurrent heart disease, but also it could be due to your medication. From the antiplatelets, I'd like to switch gears to a group of medications called anticoagulants. And before we get to anticoagulants, I want to take a moment to mention one of the commonest heart rhythm abnormalities. It's called atrial fibrillation. It occurs in about 8 million Americans. And the main issue with atrial fibrillation, besides perhaps feeling uncomfortable with the rapid heart rates is that it increases your risk of stroke. And your doctor, based on certain underlying risk factors, may determine that you need to be on a blood thinner to reduce the risk of strokes. 90% of strokes in atrial fibrillation come from this area of the heart, part of the upper chamber called the left atrial appendage. And the blood thinners, oldest of which is warfarin. And a little side note for Badger fans, warfarin was discovered at the University of Wisconsin-Madison. Go Badgers. The newer medications called apixaban, rivaroxaban, there's a few others, have an advantage over warfarin because they don't require routine monitoring of blood levels like warfarin used to, or warfarin does, and also doesn't interact with dietary green leafy vegetables, which can affect warfarin effects on the blood. So these anticoagulants play a critical role in preventing strokes and atrial fibrillation. I do want to mention, it would be remiss of me as an interventional cardiologist not to, that if you do have complications of bleeding related to the anticoagulants, there is a procedure called left atrial appendage closure where we can put a mechanical device that excludes the left atrial appendage and you can be taken off of blood thinners. So if you do have bleeding on one of these agents, talk to your cardiologist and you may be a candidate for left atrial appendage closure. In the interest of full disclosure, it is a procedure I perform. Moving on to antihypertensive medications. As you know, hypertension is one of the cornerstone risk factors, not only for heart attacks, but also for strokes. We have a variety of antihypertensive medications, but I'm going to focus on just a handful which are most relevant to heart disease. And the first one I'd like to talk about is beta blockers. Beta blockers, there are a whole variety of them, but I mentioned metoprolol succinate, also known as toprol, or carvedilol, also known as Coreg, because these are two beta blockers that, in addition to their role as a blood pressure agent, are also very useful for weak hearts. If your heart function is weak, such as after a heart attack or otherwise, these medications can help strengthen the pumping action of the heart. Additionally, if you've had a heart attack, beta blockers are recommended to reduce your risk of death from arrhythmias and are recommended generally to be taken for at least a year after a heart attack. There's a lot of evidence that comes and goes, but in general, the most recent recommendation is still to use the beta blocker for at least a year. Now, it's important to note that they do have some side effects. You may experience fatigue, which is not uncommon, and loss of libido. So if you experience loss of libido, reduced sexual desire, talk to your doctor. Perhaps dosages can be adjusted. You could be switched to a different beta blocker, and this can help you. Another thing to remember about beta blockers, they should not be stopped abruptly. It can cause what's called rebound hypertension, which can be a life-threatening emergency. Your doctor, if you need to be taken off beta blockers, will typically taper it down. Moving on to a different category, also antihypertensive medications, extremely important in the treatment of hypertension, particularly in diabetics, where these medicines, the first two categories, can reduce the risk of progression of reduce the risk of kidney damage from diabetes. These medications additionally are very useful in the treatment of depressed heart function. They reduce the work with which the heart has to work against. So they are called vasodilators. And the original vasodilators that showed an improvement in heart function in weak hearts were called ACE inhibitors. You may be familiar with the term lisinopril or enalapril. There's a whole variety of them. That resource that I gave you with the American Heart Association has a comprehensive listing of this and other medications we discuss. ACE inhibitors, probably the important thing to remember is they can cause a dry cough. So if you experience a dry cough on one of these medications, the ACE inhibitors, please talk to your doctor. There are alternatives, and namely the alternative is the next category on your slide there, called angiotensin receptor blockers. Losartan, candesartan, valsartan are a few examples. They work like ACE inhibitors, but don't have the peripheral side effects. And also, they have a reduced risk of an allergic type reaction called angioedema, where the lips and tongue can swell up in patients who are on ACE inhibitors. If that happens, angiotensin receptor blockers are an option. Your doctor may choose to put you on that. And the third category on the slide is the latest and greatest in heart failure, called angiotensin receptor blocker neprilysin inhibitor. It's a combination of two medications marketed as Entresto. This is now the first-line therapy, certainly for new diagnosis of weak hearts. It can cause a little bit more low blood pressures than the other two, and should also not be used in patients who have that angioedema reaction with ACE inhibitors. But it is one of the most exciting new medications in the field of heart failure. And just so you know, all of these medications can affect liver function in the short term while they're beneficial in the long term, and your your kidney function in the short term while they're beneficial in the long term, and your kidney function will be monitored by your doctor. Very important to stay on top of those blood tests, as they can affect your potassium levels as well. Moving on, in the next few minutes that we have here, I want to talk about diuretics. These are water pills, commonly used. Probably the most important tip I can give you is, if your water pill is suggested by your physician to take twice a day, please don't take it in the evening. It'll disrupt your sleep. Take the first dose of furosemide, for example, in the morning, and take the second dose at noon or shortly after, so that you're not disturbed at night needing to use the bathroom. These medications can cause loss of potassium in your urine, so your doctor may provide a supplement, with the exception of spironolactone, which is a potassium-sparing diuretic, and is also critical medicine in the treatment of heart failure with reduced pumping action of the heart, where it, along with the ACE inhibitors and beta blockers, can help strengthen your heart muscle. Coming to perhaps the most important medication that has altered the face of coronary artery disease, and that is statins. Statins have been demonstrated to prevent heart attacks when used in people without heart disease, to prevent recurrence of heart attacks when used in people with heart disease. If you remember the diagram of the wall of the artery in the earlier slides, statins prevent that plaque from increasing. In some cases, it can actually regress the plaque, but most importantly, it plays a role in stabilizing the plaque and preventing the rupture that attracts those platelets and the clogging of the arteries. If you have a heart attack, your doctor is going to recommend what is called high-intensity statin therapy, typically atorvastatin at doses of 40 milligrams or more, or rosuvastatin at doses of 20 milligrams or more. If you don't have a heart attack, then there are other options as well. And I mentioned pravastatin because it has probably the least amount of side effects and interactions with other medications. So if you've tried statins and you really can't deal with the side effects, particularly the muscle aches, which are not uncommon, pravastatin may be an option. And I also want to point out that simvastatin, while it's the original statin that showed the decrease in the risk of heart disease, simvastatin does have a lot of interactions with other medications and increased side effects, particularly at doses of greater than 20 milligrams. So if you're on simvastatin at doses of greater than 20 milligrams, talk to your doctor about it. And just to mention that grapefruit juice can increase the levels of statin, particularly atorvastatin in the blood. So be careful if you are on atorvastatin and you like grapefruit juice. All right, in the closing few minutes that we have here for this presentation, I want to talk to you about a potpourri of some of the exciting medications that we have available now, as well as a few older medications and some important interactions and considerations when we use this. So for those folks that can't tolerate a statin and have heart attacks or heart disease, we do have injectable medications now that are taken typically twice a month. Repatha or evolocumab is one of those medications. They can really drop your bad cholesterol levels down and have been shown to be extremely effective and beneficial in the prevention of a second heart attack. So if you just cannot tolerate any statin, this is an option you may want to discuss with your physicians about if they don't bring it up first. I also want to mention this category of medications called SGLT2 inhibitors that Jardiance is an example of that. Empagliflozin is the generic name. These are medications that prevent the loss of, actually prevent the reabsorption of sodium and glucose in your urine back into your blood. They are extremely good medications for diabetics. They reduce the risk of developing kidney damage. They're also very useful in heart failure, but they do cause an increase in urinary tract infections, probably from all that glucose that's being excreted in the urine. So if you are on it and you're having frequent urinary tract infections, please mention something to your doctor about it, and they may decide to take you off of it or try a different category altogether. Can't have a talk on cardiovascular medicine without nitrates. Nitrates, most of you are probably familiar with the tablets that people put under the tongue. One quick thing, if your doctor prescribes it and you need to use it, make sure you're sitting down or laying down because it can cause a drop in blood pressure and you don't want to fall down. And number two thing is nitrates can interact with drugs used in the treatment of erectile dysfunction like Viagra or Cialis. So if you're using nitrates, don't use Viagra or Cialis. And if you are using Viagra and Cialis, and let's say you have to call 911 for some chest discomfort, make sure you disclose to the EMS that you have taken Viagra or Cialis, because otherwise, if they give you a tablet under the tongue, you could have a life-threatening low blood pressure reaction. Want to make a mention of amiodarone in that it is a widely used medication in cardiovascular medicine, but has a lot of side effects and requires diligent monitoring. In the Marshfield Clinic, we have registered nurses that have a protocol and will monitor your amiodarone for side effects. Eye, liver, lungs. It's a whole host of systems that can be affected that need to be monitored. So if you're on amiodarone, please make sure that you're being monitored. Well, Ashley, we have 8 minutes left. I'm just want a quick acknowledgement. Of course, Ashley, thank you for getting this program together. And I also want to shout out to Erin Tennyson, who helped make my slides pretty and helped with the presentation here. And Miriam Peters is my daughter, who helped me to take doctor speak out of it as much as possible and helped with some of the presentation aspects. So thank you all.